The New South Wales government has announced a sweeping coronavirus lockdown from 6 p.m. today. The lockdown, initially restricted to 4 local government areas in Sydney, will be expanded to Greater Sydney, the Blue Mountains, Woolongong and the Central Coast. The restrictions will begin at 6 p.m. today and extend until at least midnight on Friday, the 9th of July. Well, for more, we are joined now by reporter Rani Hayman in Sydney. Rani, just take us through the specifics of this latest announcement of the lockdown extension.
Good afternoon. Well, as you said, the Premier Gladys Berejiklian a few days ago said that this was the scariest period of time that we've been going through since the beginning of the pandemic, and she said that today has proven to be the case. As of 6 p.m. tonight, Greater Sydney, the Blue Mountains, the Central Coast and Wollongong will be going into stay-at-home orders, into a lockdown until Friday the 9th of July. Now, people will not be able to leave their homes unless for 4 essential reasons, and those reasons include shopping for food or other essential goods or services, medical care or compassionate care, and that includes going to get vaccinated with the COVID-19 vaccine. Also, exercising outdoors. No more than 10 people are allowed to gather outdoors at one time, and essential work or education. But the Premier, Gladys Berejiklian, was very strong about saying that if you do not need to come into work, do not do so. Try to work from home. Now, we know that community sport will not be permitted for that 2-week period. Weddings will only be allowed tomorrow under COVID-19 restrictions, but from Monday they will no longer be permitted. And also funerals will be capped at 100 people, and masks will be mandatory with the 1 per 4 square metre rule applying there. Here's a bit of what the Premier, Gladys Berejiklian, had to say earlier.
That when you have a contagious variant like the Delta virus, a 3-day lockdown doesn't work. If we're going to do this, we need to do it properly. There's no point doing a 3-day lockdown and then having the virus continue to bubble away in the community. Now, if after 7 days there's a dramatic change in the trend, well, obviously we'll evaluate the situation. But at this stage, the best health advice we have is that a 2-week period, or until midnight the Friday the 9th of July, is necessary in order to make sure we get to our target of 0 community transmission, which has always been our target from the beginning of the pandemic. Given how transmissible the virus is, given the extra exposure venues, we know that even the best contact tracers in the world can't stay a step ahead unless we put this in, and we need to do it properly.
Gladys Berejiklian. Now, Rani, with the latest cases, there's been some concern around a particular case of transmission. What is behind that particular concern for authorities?
Yeah, so we heard today that there were 29 locally acquired cases reported in the 24 hours to 8 p.m. last night. 17 of those cases had been announced yesterday. Now we know that there are 80 cases that are linked to the Bondi cluster in Sydney's eastern suburbs. So those numbers are rising quite dramatically. But one area of concern, there was workplace transmission at a food retailer, the Great Ocean Foods at Marrickville in Sydney's inner west. The delivery drivers for that service there have tested positive to the virus, and the Chief Health Officer, Dr. Kerry Chance, says anyone who received those deliveries between the 21st to the 25th of June are at risk, and they are considered close contacts. So those people are being urged to immediately self-isolate and get tested for the virus. We've also heard a number of other venues that have been identified as venues of concern by Dr. Kerry Chance. She said the Cheers Bar at George Street in the city, in the Sydney CBD, in the early hours of the 20th of June, there was a COVID case there, so people there are being called close contacts also. And at the Rebel Sports at the Bankstown Shopping Centre on the 24th of June, people who were there at the specified times are also being considered close contacts. So for more information on that growing list of exposure sites, they can be found on the New South Wales Health website. Here's a bit of what the Chief Health Officer, Dr. Kerry Chant, had to say.
We need these measures in place to allow us to bring this outbreak under control. As the Premier has indicated, the contact tracing and testing numbers, despite them being quite high, the testing numbers, and the contact tracers getting in contact with people rapidly, what we're seeing is by the time we've got there and uncovered these chains of transmission, we have had a number of people infectious in the community. Given we are aiming to get to no community transmission, and as we roll out the vaccine, it is important that we get to that as quickly as possible. So the restrictions need to be applied absolutely, and it's critical that we all comply with them if we are going to achieve that no community transmission, and the duration of the lockdown remains at around that 14 days.
Dr. Kerry Chant there. Now, Rani, while the immediate focus obviously is on Greater Sydney and those extended areas around Sydney, there are concerns about areas outside and beyond that in the regions. What's happening there?
Well, that's right. That was one point that was made during the press conference just a bit earlier. The Health Minister, Brad Hazzard, really made the point of saying that he does not want this virus travelling out to the regions. People who do live in regional New South Wales will also be subject to restrictions, and those include no more than 5 visitors at a person's house. The one per 4 square metre rule will also apply at indoor venues there. 50% capacity at outdoor events, and the same restrictions will apply for funerals and weddings. We heard a little bit earlier this week that fragments of COVID-19 were found at Bourke, which is roughly 800 kilometres from Sydney. So there were already concerns that the virus may have travelled to the regions, and that is something that obviously health authorities want to avoid at this point in time. Here's a bit of what the Health Minister, Brad Hazzard, had to say.
The concerns we have at the moment are extremely high. The Delta variant of this virus is certainly moving around our community far faster than anyone could have imagined, and it's now up to all of us to fight back. We can fight back by taking simple measures. Just following the instructions that our Chief Health Officer have given is potentially the answer. I want to also emphasise that the point that we don't want this this very dangerous virus, to get into our regional communities. We know it's already circulating here in parts of Sydney. We don't want it into the regional areas. The emphasis now is to defeat this virus. We all need to stop moving around unless we absolutely have to. Don't play games with yourself and with the community. Please stay at home unless you really need to go out or you have one of those 4 reasons, and even then, think twice before you do it.
Health authorities are really trying to ramp up their approach to this. This Delta virus strain is different to what we dealt with earlier last year when we went through that lockdown in March. Health authorities say that they are expecting more cases to continue to pop up in the coming days, and they believe that this 2-week lockdown is the only way that they can get on top of the transmission of this virus. We've heard from the Chief Health Officer, Dr. Kerry Chant, that in the past, with the past variants of different virus, the different COVID-19 virus, that the household contacts of people who did have the virus, sometimes there would only be 1 or 2 people within a family who were testing positive. Now what she's saying is that with this particular variant, they are seeing cases where whole families are testing positive to the virus. So what they have said is that it is harder for them to essentially keep up with the spread of this Delta variant of the virus, and they have said that we will be expecting more cases in the coming days.
Reporter Rani Hayman there with the latest in Sydney.